Hi, it's Dr. Iannitelli here. I just wanted to talk to you guys for a few minutes about one of the procedures that some of you may or may not know that I do. It's called the Priapus Shot, and the Priapus Shot is a shot for erectile dysfunction for men. I know some of you may be uncomfortable speaking to me about this subject because I am a woman, but I promise I am well versed in this. And this is not the first discussion I will have had about it. I used to do some general practice as well back in the day, and I used to only have medications and surgery available to me to treat this. And this wonderful new technique has come along from Dr. Runels, who is the inventor and creator in Alabama. He also trained me. It was a wonderful experience, and I'm really happy to be offering this into my practice. It's a great alternative because there are a lot of drug-drug interactions, especially with blood pressure medications, with drugs like Cialis and Viagra, and there are also a lot of side effects that some people might not be aware of, like getting dizzy or flushed, lightheaded. So they're not without risk and complication. Also, they're fairly expensive, and a lot of insurance companies don't cover them or don't fully cover them. So there's an expense there, and there's also some planning as well. So why not correct the problem versus kind of band-aiding it or doing a quick fix? Um, there are also some surgeries that are out there, but those require general anesthesia, and general anesthesia comes with its own risks. Forget the risks that are involved with the surgery. So, a little bit more about the Priapus shot. It uses something called PRP, which is plasma rich platelets. That's a component of your own blood. You come into the office, we do a quick blood draw, we spin that out and separate the components that we don't need. PRP, or plasma rich platelets, has been used in other applications. A lot of you might know or might not know that I do interventional pain management, and PRP has been used in orthopedics and pain management for a long time very successfully, and it has now just made its way into the sexual health realm. So we can treat erectile dysfunction with it. We can also treat something called Peyronie's disease, or scarring of the penis, which can affect both function, aesthetics, and the ability for patients to be able to use their genitalia for sex, period. Another interesting fact is that about 40% of men over 50 have some type of erectile dysfunction. So if you feel like you're alone, you are definitely not. So you come into our office, we draw a little bit of your blood, we numb the area up so that it is virtually a painless process. We prepare that component of your blood that we need, and then we do a few injections. Like I said, with the numbing, it's virtually painless. And then immediately following the procedure, you do have to use a penis pump, and it is also part of the post-procedure protocol, as well as we do encourage people to have sex and try it out that evening. But it will help erectile dysfunction from diabetes, from blood pressure, from multiple different disease states, and it actually goes in and fixes the tissue so that there's not an issue with it anymore. So if you have any questions, we do have a great book that goes over everything in detail that you can pick up for free at our office. And after you read that book, we are happy to answer any additional questions and get you scheduled for the procedure. So I hope you learned a little bit today. And if you are suffering from this, it not only affects things in the bedroom, but it can affect self-confidence and your intimate relationships in many different ways. And we would love to be able to help you out and get things corrected, see if you're a candidate. So please call our office at 480-845-4121 today and set up your complimentary consultation.